Hello, so this is the interface of SeaScope CDS. First, we will log in here with our email and password. After authentication, we will find this is our UI. Then you have to choose if you want to go dark or light mode. And then the next thing that we need to do is select our ship. Here in the right, for example, I'll be selecting Explorer of the Seas. Use the ship. Then we'll see Explorer is in Port Canaveral, for example. So everyone, first, the thing we need to do is to choose our vessel. I will be surely adding other vessels and fleet. And as you can see, after we get the actual position of the ship, we also get the weather and sea conditions. So this is important to the system to understand where we and what the decisions has been taken. Now we have this in the left panel, we have our patient snapshot. So we have here some cases, they're preloaded, but it runs in real time. So you can just test the function, STEMI, anaphylaxis, DKA, sepsis. So for example, the most important, let's say STEMI, is completely fully working. So you can change wherever you like. Let's say you want to run this. First, we put the age or vital information of the patient's medication history, allergies, our labs. Here, for example, we are mentioning that we have a positive troponin and where are the leads that elevated here, where are findings. We can also put how the patient is, for example, here is tachycardic, wherever you want to input here. Also, here in the past medical history, you can choose wherever are the conditions like surgical allergies, all of this information that you can add to the system after starting to analyze, it will give more context to the tool to work with. So let's say we already have all our clinical information. Now the system is understanding what is available in your formulary, right? What's the best or most probable diagnosis? And then is checking also your position right here is understanding what are the weather, what are the sea conditions, where are you located in the world at the moment. And then it will give you the best options, not only for treatment, also the logistical point of view in regards of evacuation or treatment. For example, we have an STEMI case. Let's see what it says if we have an STEMI case while we are in port, in this case, in Explorer of the Seas, right? So at this moment, we have here clinical assessment, our working diagnosis, okay, acute inferior STEMI. What is the transfer decision? Is immediate evacuation recommended? Pier-side ambulance. We agree with that, right? If we are here in Port Cañaveral, we are not going to call the Coast Guards. We're going to call an ambulance pier-side, right? We have here our clinical assessment, a 75-year-old female with these conditions. Then we have our ABCD walk. All here, we have also a safety check with the medication that she's taking. The system is able to recognize and cross-match everything for looking for drug interactions and secondary effects, right? Key findings, fibrinolysis, for example, is required, but it's withheld because the primary PCA is accessible. We are in port, remember. So in this case, the system is not recommending you to give you the Tecnectic Plus. Why? Because you are near. You're near to the hospital, and I think we all agree on that. If we have a patient with this presentation and we know this patient can be taken in a more capable facility, we are not going to do this, right? So the system is smart. The system understands what our environment, they understand our needs and the logic behind the decisions that we take, because it's not the same practice in medicine in a cruise ship is not the same in a remote area that in a hospital. So we work under different logic, and I think we all agree on that. The system also gives you this monitoring plan, right? It gives you these important calculators, the TIMI, KILIP, here, the checklist. Is this patient, yes, is eligible? Okay. Now, what you can do, what you can give. on the patient, aspirin, clopidogrel, enoxaparin. You can do all of this before you disembark this patient. And you can see here the batch it takes to the latest clinical guideline where this is being taken from. Okay, additional, you have these medical resources, another more compiled academic resources if you want. For example, here you will see some PubMed, the Necteplas, studies, references that you can just have a look if you want to have more information. So the system is not only giving you the recommendation, the treatment, the guidelines, it also gives you some additional medical support, right? Now you have a timeline. You can start here, okay, I already give the aspirin, we have an IV, we give fluids, okay, so you can work with this. And this is, the system gives you this customized for every patient, different based on what is the diagnosis and what is the treatment that you need to do, right? Now, in the follow-up, this is a very good feature that we have, right? For example, we can put here now this patient is unresponsive. So what happened when I tell the system that our patient is not responding? Now the system knows exactly what's happening. There's a critical deterioration. This patient presents a cardiogenic shock. So what is the immediate actions? Of course, we know check the pulse, ABC, CPR, blah, blah, blah. But importantly is understanding the patient. It's not like ChatGPT because he already knows all your information, hold or oral medications. It has a clinical reasoning, a real clinical reasoning. Now, for example, do we have the Necteplas, for example? I just want to double check. The system knows your formulary and never will hallucinate anything that you don't have. ChatGPT or any other AI tool, you can input the clinical case and it will give you the guideline, but it doesn't know exactly what's happening, right? Let's see here, for example, in this case, yes, the Nectar Plus is available. However, it's not recommended because you are proximity to the PCI and also your patient is in shock. So now you have a cardiogenic shock. Okay, febrile disease is often ineffective in shock states because of the low perfusion. So obviously, we are giving priority to do the CPR. Obviously, we need to assess this patient, right? So don't administer tenectoplas, prioritize support on transport, right? So the point of this is to show you that the system is completely aware of your situation and how this model can give you this kind of recommendations in less than a minute with all the information that we can provide. Okay, so for all the testers that will be using the tool, you will have access to this tool for 1 month for free. You can use it as many times as you need. Remember, you can use here and you can put here everything. Here you choose your age. You can choose, for example, a respiratory, GI, wherever the case. You can choose everything here. The system will help you to understand your patient and give you the best recommendations. It's based on the latest clinical guidelines, so you have a very good consulting tool here. Okay, I'm available through WhatsApp. I'm sending you this through WhatsApp, so you can reach me anytime. You can DM me directly with all the feedback that you have. At the end, you see here, will you follow this recommendation? Please, please, always that you run a case and you say, yes, I agree, you can click yes. If you say partially, please help me understand why. So you can put here wherever is your feedback and you can submit to me. I will be able to have all your feedback. Okay, I really appreciate all the interest in this tool and I hope that these kind of tools are being deployed in our fleets so we can have more safe environments. We are reducing cognitive loads in our physicians. We are having a good use of our AI and the new technologies, all for our own safety and also most important for the safety of our patients. Thank you so much, everyone.